Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
It says smoking. As we know, smoking is very dangerous, while sitting is equally dangerous especially if you sit all day. Now, if you sit down for 1 hour and that's it, that's not as dangerous as sitting down all day as some people have to do in their jobs. And so it becomes important for them to stand up and exercise and do pedal exercises and other things. Otherwise, those sitting jobs actually put your health in great jeopardy.
Dr. Callender, on that note, that's one of the reasons that I'm I'm taking physical training, is because I enjoy walking. I can walk sometimes 10,000 steps a day. My average is like 6,000 to 7,000 steps a day. But what the physical trainer was telling me is that walking is great, but you've got to do some strengthening exercises, and that's what has happened to me. I was not strengthening some of my thigh and hip muscles, and that was causing some of my pain that I was having. And now everything is getting back together.
Yeah, very good. Glad you mentioned that, because those exercises you speak of and resistant training becomes very mandatory. It's incomplete without those, and so I'm glad you mentioned that.
You know, also people who drive are sitting.
Right. Yeah.
You know, you think you're getting out and doing stuff, but you're switching seats. That's all. You know, it's not exercise.
And the number one cause of sitting is watching television.
Yeah. Which is equally hazardous because it begets isolation and other things that aren't so good. Okay, John, I guess you can start the show going.
Right.
Things are changing. I put this in there because we all have children and grandchildren. And one of the things that we don't talk as much about, although we talk about it some, is the prevalence of substance abuse. And in the month of October, our CEO pointed out some of the issues relevant to substance abuse, which, while we may not be involved with substance abuse, our children and grandchildren and great-grandchildren may well be. And so these are some interesting statistics which I thought you might see. 11.7% of Americans 12 and older, look at that age, 12 and older, use illegal drugs.
Wow.
And almost 20% of people have used illegal drugs or misused prescription drugs in 2021. If you include alcohol and tobacco, the number rises to 60%, which is unbelievable. I'm amazed at the number of people who still smoke in terms of alcohol, which is more addicting than tobacco. When you include that, to have 60% of the people older than 12 who use drugs, that's kind of frightening, isn't it? Any of you surprised by any of this?
No.
I am. Yeah, that's a phenomenal number. The number of people who died from a drug overdose in 2021 was more than 6 times the number in 1999. I guess they're telling us that every day. Almost 20% of nurses show signs of substance abuse problems. Physicians become addicted to drugs or alcohol at least as commonly as the general population does. And 10% to 14% of physicians suffer from addiction to drugs or alcohol during their careers. To me, those are phenomenal numbers that are frightening.
Dr. Callender, I think it's frightening also, like the nurses and the physicians. I was like, gee.
Yeah, yeah, yeah. All of that to me is signs of our times and does not augur well for our future. Yeah.
Dr. Callender, do the anesthesiologists have a particular problem with addiction?
Yeah, they're number one because they deal with drugs. So they're number one, and psychiatrists are pretty high as well. But I think anesthesiologists are number one or two, number two in the list.
I thought so because the fact that they have access to those drugs that can really put you to sleep.
Forever, you're right. Yeah.
No.
Okay, let's go to the next one. This is interesting because we've talked about the fact that we now have Narcan that is over the counter, and the question is that going to be enough to stop the death toll? Anybody think so?
No.
No, I don't think so.
It's so much more than just getting them to wake up after they've tried overdose, because they probably will do it again and may be successful if nobody's around. But it's still a good thing to do, to make it available so that people have it. And if you find somebody who's down, you can spray them with the medication, and they may wake up. So I think it's something that is worthwhile doing. Any comments on that?
I had a question. So if someone is overdosed, but that implies that they're still breathing, so the Narcan can work because they're able to inhale it, right?
Yeah, well, that's correct. Although spraying it will get it into the bloodstream as well. So, and you're right. It depends on how soon you get there. If you get there when they've had that unconscious for over 10 minutes, then it's too late. But if you get there right away, most of the people will wake up. But you're right that if they're dead, it's not going to help them. But if you get to them before they become totally, before they stop breathing, it's likely to work. Anybody against it? No. Okay.
I'm really for it. They need it in all the schools, I think. All the high schools.
That's a good point. Since, as you saw the data, they talked about over 12, meaning that, and we see that kids are dying in school, and all levels of school, elementary, middle school, and high school. So,
Dr. Callender,
yes.
if a person is drunk, would that hurt them? I mean, if you saw somebody, you might not, I couldn't tell if somebody was drunk or if they had passed out from drug abuse.
Yeah, well, it will only help for if they've had fentanyl or one of those other drugs. It's not going to help for alcoholism.
But it wouldn't, I'm just saying, it wouldn't hurt somebody.
No, it's not going to hurt anybody.
Okay.
No. Yeah.
I'm not against it. I think what's happened is that more white children are having problems, and that's why it's turned into a cause celeb now.
Yeah, many people feel as you do.
But
Yeah.
any kind of way people can get help, I'm all for.
Yeah.
Yeah, I just heard on the news yesterday that Hunter Biden was on crack cocaine, and now crack cocaine and powder cocaine is cut with fentanyl as well. So
Right.
it definitely crosses over all boundaries. No one is immune to this.
What
Yeah.
about the cost of it? $44. Is that a lot of money, or what do you think?
I think it's a lot of money.
Yeah.
How long does it last? What's the shelf life?
I don't know. The shelf life.
$45.
If I had a child that was on drugs, I think I would buy it.
Yeah, I would
Or
too.
if I had a loved one that I was around a lot, I would buy it. Or if I was in a profession, like if I worked at a clinic or I was doing outreach, I would buy it.
Since it's over the counter, I would think it probably has an expiration date.
Right. I just was wondering if you buy it and don't use it, how long would it last?
Yeah, and I don't know the answer to that. Yeah.
My son-in-law is a police officer, and they carry it around with them at work.
Mhm.
Yeah. Yeah.
But they have some on hand in all
Good.
cases. So I'll ask him, do they have to renew what they are carrying around with them every so
Yeah.
often?
Yeah.
The FDA has approved a 36-month shelf life for Narcan.
Oh, good. This worth the $40 then if it's got a three-year shelf life.
But don't forget that's a 2-dose package, so it's $25.
Right. Right.
Sounded like a worthwhile experiment to see if it will make a difference. Okay, let's go to the next one. This is an article that caused a lot of discussion. I mean, we've had a lot of comments about the fact that colon cancer and colonoscopy and prostate cancer as well is affecting younger and younger people. And so this is a recommendation from Preventive Services that they should lower recommended age of routine screening mammograms to 40. And that this would result in saving more lives. And of course, we've encountered in the African American community many women under 40 who have breast cancer. And still, if you have a lump in the breast or anything like that, it doesn't matter what age you are. You need to have a breast examination and have screening. But this is an issue that affects all ethnic groups, but especially African Americans and Latinos. But the interesting thing is that most of the physicians of color are aware of this, so they recognize this. But the white population is less aware of it, and often doesn't believe that the lowering of the screening age is necessary, but it is, especially for us. Any thoughts about this? Any other additional thoughts about the lowering of the ages for colorectal screening, for prostate cancer, and now mammograms?
I think it's a good thing.
Yeah, that along with the people who have thick, high density breasts who need special screening is important for all of that.
What's interesting to me, Dr. Callender, is that you can relate these various types of cancer to diet.
Well, it seems like diet is related to everything, it seems like.
Yes, sir.
Diet and exercise.
And stretching, as
Yes.
George told us.
It's still
Yes.
exercise. Still exercise. Yeah. It's just that the appreciation of the fact that resistant exercises are aerobic exercise is great, but it does not stand alone. It has to be combined to be optimal. And many of us don't do enough of that kind of exercise. So next one, please. Now this is an interesting observation, and we talked at one point about the menopause, and that one of the concerns was estrogen creams and other things, because there's some evidence that they may increase the risk of cancer. But now there's a treatment with vaginal suppositories that have HLA, hyaluronic acid, which reduces the vulvovaginal symptoms of the menopause. We know about the vaginal cream, but with this estrogen, but now this is another way of addressing symptoms. And many women are reluctant to take any treatment for the menopause, but this is specifically for the vulvovaginal issues that result from the lack of estrogen. Any of you women have any comments about that?
No, I wouldn't do it.
The risk is too
And I'm
great.
somebody that still has hot flashes.
Yeah, it didn't say, did it get rid of hot flashes?
No, this just gets rid of the vulvovaginal skin issues that associate with the menopause. It does not address the hot flashes.
Well, that's what women are most concerned about, is the hot flashes. The rest of that stuff
Right.
jump. We don't care about the rest of the stuff.
Well, actually, that's not true. Some women are concerned about the itching and the other burning and dryness in the vagina that occurs as well.
Yeah.
Yeah. So
Or at least they don't talk about it.
yeah, they may. Well,
That's more like what it is.
that's more
probably.
likely that they don't talk about it. Yeah, right.
Mhm.
Okay.
I
Well,
was really
anything
hoping.
that would help. What'd you say, Darryl?
I was really hoping that there was something in semen that would promote the hyaluronic acid in women, but it's the opposite. There's an enzyme that's called hyaluronidase that's present in semen, and that degrades the hyaluronic acid around the ovum. And that's present to allow effective penetration of the sperm into the ovum for fertilization. And so, yeah, it's semen is runs counter to what women need in menopause.
Sorry, ladies.
Yeah, well, some of them are not worried about having children. I know that.
Of course, we have mothers who are older than 40 who find
Yeah.
out that the lack of menstrual period is related to pregnancy. Now, this is an article that we've discussed to some extent, that the prostate cancer screening guidelines to get PSA or not. And it's clear to me that for people of color, they need to get PSAs. It's also clear that as far as the white population is concerned, that is not true as well. Although much of the data that we're accumulating now is suggesting that screening should be started at the age of 40, not 50. But especially in people of color, there's a need for PSA. Now, there are also other things that could take the place of the PSA, but they're much more expensive, but they may be even more effective, like MRIs and other things. may also get an early detection of prostate cancer. One of the things that is not discussed is what is the negative consequence of not getting a PSA. And that's why most urologists of color will recommend it to their male patients. We discussed that prostatic hypertrophy or prostate cancer is something that all men will get if they live long enough. So close to 90% of the autopsies that are done for people who are over the age of 70 have either prostatic hypertrophy or prostatic cancer.
Dr. Callender, what is the hypertrophy? What does that mean?
Benign prostatic hypertrophy is what occurs, which means the prostate gets large, and so it affects the ability to urinate, so that you have to wake up at night and urinate, and you have to go frequently to urinate because the prostate gland becomes large and obstructs the flow of urine out of the bladder. But the term is prostatic hypertrophy. And so the prostate becomes enlarged, but may not have cancer with it. So that's the benign aspect of prostatic growth, whereas cancer is malignant growth of the prostate. That requires intervention such as surgery or radiation, or that kind of thing. Any comments about that and about the role of PSA?
I have one comment. Several of these articles you're mentioning about how people of color are affected more on certain of these diseases and so forth. That's a shame. It makes you feel like you need to change your skin color or something.
Well, there are very few illnesses for which people of color don't have a greater predisposition. Thinking of changing your color, you can't do it anyway. So why think about it?
Dr. Callender, what I do is try to get in tests and testing and research projects, because we need more Black people in those types of things.
We do. There's a dire need of that.
So, Marilyn, to your point, is there a place where you can go to sign up for those things?
Well,
I found out about one at Howard. I like to look on bulletin boards and pick up pamphlets that are around, and that's how I got into the Howard study on aging and exercise and memory. And then I guess from that, I don't know, because in my algorithms in Facebook, I get a lot of them. If I'll send some. I told you about Meridian. I can send you that. But I'll send you some of those things.
Sounds good. Thank you.
Finally, people of color can get some money.
Some of them pay, but some of them don't pay. But that's not why I'm doing it.
They don't pay very much anyway.
Not enough.
No,
Not
you do
to
it because you want to get an early start on some of the knowledge about these diseases.
Yeah, but I want there to be a Black presence in things.
In the studies, exactly.
Right. And that's what I have. I have my Black self.
And we need more people like you. Okay, this next one. Now, this is an interesting article, especially since we give tips, but we don't really know if we're preventing dementia because we aren't absolutely sure what causes dementia. And we have a lot of theories about it. One of the things is medication that we have that is thought to be treatment for dementia is not accepted as the treatment for dementia. It's a way of trying to delay the progression of dementia. And look at these numbers that 50 million people worldwide live with the disease, and it's projected to reach 152 million by 2050, which is a tripling, which is frightening. And as you encounter more people who age, you encounter more people with dementia. And this is an article that suggests that the modifiable risk factors are smoking and lack of exercise and poor nutrition. And so it articulates the 5 reasons. They start off with a healthy diet, which you would almost be tired of hearing the same thing, but the truth is the light. So when the truth is light, you have to tell the truth. So when they talk about the diets, most of the diets emphasize fruits, vegetables, fish, and other things. So, and eliminating red meat, eggs, and sweets, so that over time, one of the first things you want to do is have a proper diet. I think you went down a little too fast because hypertension is the next thing that they talk about. Hypertension contributes, according to many of the studies, contributes to dementia as well as other chronic diseases that we know so well. So if you've got hypertension and you're taking medications, but your blood pressure is not being lowered, then the risk for dementia remains. Because sometimes we forget that it's not just taking the medication, but the medication must do the job. The blood pressure must be normalized. And if it's not normalized, then your risk for diabetes, for all of the side effects of hypertension, heart disease, etc., kidney disease, remains. And so most people believe that the blood pressure after age 40 should be 130 or less. And if the medication you're taking is not doing that, then you need to take additional medication. The question is, how many people are taking their blood pressure at home, and how many people are ensuring that their blood pressure stays 130 or under? And I think that is as important as everything else that we do. Smoking is well known to be a premature cause of death, but that hasn't stopped people from smoking. And it's what is frightening is that more people smoking abroad than they smoke here. And we started the ball rolling with the poisons of nicotine, and we spread it all over the globe, which is unfortunate. And still, people in the United States are smoking, men and women, people of all ethnic groups as well. Then alcohol, we've legalized alcohol, and alcohol addiction is ever with us. And it is going to be back to be the #1 cause of the need for liver transplants, because hepatitis C is now been conquered, and so alcohol is getting back to #1 again. And the impact of alcohol on the liver as well as the brain is something that we know is associated with dementia as well. And one of the other things that he talks about is, of course, exercise. The fact that exercise is important to deal with. Now, one of the things that this aspect talks about is the genetic predisposition to Alzheimer's, and that people with the APOE E4 allele inherit an increased risk to developing Alzheimer's. But not all people with the disease have the E4 allele. And just because you have the E4 allele does not mean that you'll get the disease. So altering your lifestyle becomes important. Healthy diet, low blood pressure, exercise, heavy drinking, avoiding drinking and substance abuse suggests that we can do things to decrease the likelihood of us getting Alzheimer's as we age. Any comments on this article, which I think is an important one that emphasizes things that we've already emphasized? Any other comments? Any additional comments?
Is this another disease that affects Black people more?
Yes. I think almost every disease you mentioned affects Black people more. Blacks, Latinos, and Indians, and Native Americans. Yes. Yes.
When you go overseas, you see cigarette ads all over the place, and you can still smoke most places.
That's frightening to me.
It
That's
is
true.
frightening, but the advertisers are American companies, and they
Yeah.
glamorize smoking.
Sadly.
You know, like they used to do with us. The Marlboro Man is alive in Zaire. It's sad.
It's very sad, and it's affecting all ethnic groups. In Europe, it's all ethnic groups.
Such a hard thing to quit smoking.
It's addiction. It's another addiction, just like
Yeah.
alcohol.
Right.
Yeah. Okay. All right. Now this is interesting. The link between loneliness and Parkinson's disease. The Surgeon General talked about an epidemic of loneliness, which is contributed to mightily by the pandemic. But heart disease, stroke, dementia, and premature death, along with now linked to Parkinson's disease. And I don't know, I don't see as much Parkinson's disease in people of color as I did in white people. So that may be an exception to the rule. But it's interesting that isolation and loneliness appears to be high risk for Parkinson's as well. And so the importance of having friends and being socially active becomes very important, because alcohol abuse, drug abuse, and suicide become more likely to be an option. Although you might think 0.03% is not much of a percentage, but it's statistically significant anyway. And I like this talk about what can you do to reduce loneliness. Be a friend to somebody. Befriend somebody.
Dr. Callender, do you
Yes.
think this is why there's a push to get people to come back into the office? You know, because no?
No, I think that's all financial. That's all about money.
Hmm.
Yeah. You think about all these buildings that are vacant and for which the government is not getting, and the DC government is not getting taxed on. You realize it's primarily financial.
Right.
I'm not saying that it isn't good to do it, because people need to be more socially involved. I'm just saying that the real reason is financial.
Dr.
Any
Callender,
other comments?
yeah, going around looking at some of these assisted care facilities, Carol and I have noticed that some of them give you an option of being around a lot of people, or give you a room where you're more to yourself. And then the third category is they'll give you a facility that gives you a choice. When you want to be around a lot of people, you can. When you want to be alone, you can go to your room and be alone. But to your point, it seems as though it's better to be around a lot of people as much as you can.
Absolutely. Absolutely. All of the evidence suggests that. It says there's no pill for loneliness. And God help us if there ever is. Because socialization is so key to humanity. But everybody doesn't have partners. So
That's true.
so you can still have friends whether you have a partner or not.
I tell people to volunteer.
Yeah,
That's how you can meet like-minded people.
good advice. Good advice. That's one thing you get on this group program is good advice. Whether you take it or not is another question, but you certainly
Right.
get good advice. Okay, let's go to the next one. I thought that was interesting that you're talking about, usually it takes Nobel Prize laureates at least 20 years to get a Nobel Prize. And of course, their groundwork and research was done some time ago, but it's not the impact of what happened and the many lives that were saved forced them to give them the prize. It's interesting. So far, there's only been 13 female scientists to win Nobel Prize in medicine and physiology. Of course, there's Marie Curie, who won 2 Nobel Prizes, but women getting it is more than 600 Nobel medals. Only 26 have gone to women. That's interesting.
Wow.
And yeah.
How
And
many Black people? I know of.
there are a lot of Black people, but not in the sciences. We have a lot of in the social arena and artistry, but not. Look at the numbers for women. Yeah, so that there's no question that there is discrimination among women. So, I mean, if there was any question, this graphic eliminates the question. Physics. Look at this physics. Even though Marie Curie won in physics, and then in chemistry, it's the same thing. The only place where it's different is in the social sciences, peace, and those other things. So
In
this.
case anybody,
Go ahead, Darryl.
in case anybody was wondering, the current value of a Nobel Prize is about $1 million.
Right, in contradistinction to the American history, which is the Lasker Prize, which is only $100,000. And it's interesting how that mRNA was not really thought much of until this happened. And they did this in the mid 2000s. So, but the vaccine, I think, would be considered a revolution. All right. you know, remember when they first came out with the vaccine, they talked about the role that the female black scientists played a role in some of this research, but apparently that was later on, and these are the people who actually first developed it. Now, very few of us have gotten the RSV vaccines because they're hard to keep in the pharmacy. Of course, Mary Ellen was involved in that, and so they are recommended for all now. I don't know. Have any of you gotten the RSV vaccine yet?
Not yet. Can't find it.
Yeah, it's hard to get.
I asked the Kaiser if they don't have it, but I get my COVID vaccine this afternoon.
Oh, good for you.
Yeah, I looks like our pharmacy is the back order has been filled, so people are now getting the COVID vaccine as well. And the difference is that you see on when you get the new vaccine that it's not bivalent anymore, and also you see that it is associated with labels for 2023 and 2024, implying that it's a yearly vaccine. Anyway, these are the side effects that associated with the RSV vaccine in people of our ages.
Dr. Callender, with the COVID vaccine, I know in previous years they had one that was specifically for people over seniors, people over 65. Is that still true with this vaccine?
No, it's for all adults.
Regardless of age.
Yes. It's just that it seems that more people are taking it because when you go to the pharmacy, you see that sometimes they have signs that the vaccines are not available. And that's true for the RSV as well as the COVID. Not true for the flu, because they have plenty of the flu, but they don't all have it.
Is there a special flu shot for older adults, Dr. Callender?
Remember, there is a extra strength flu vaccine that adults should take. If you're over 65, you should ask. You should be sure that they have that for you because you require higher dosage for the flu than people under 65.
And that was my mistake. I said COVID, and I meant to say for the flu, 65 and over for the flu.
So
yes, I said COVID by mistake. I'm sorry.
Yeah, but yeah, for the flu, yes, you do need to ask for the high potency vaccine. Well, who should not get the vaccine is the same answer for most vaccines. If you're allergic to any component of the vaccine, yeah. A COVID booster is safe, and I think one of the things that we have to understand is that the shot we're getting now is not the bivalent shot. It's the shot that is more sensitive to the variants than the other. The bivalent is no longer available because the COVID vaccine that is coming out now is addressing the new variants, whereas the bivalent does not address some of the new variants. And remember that myocarditis is one of the side effects of the COVID vaccine.
With the COVID vaccine, are they still requiring people to have the white card to show when you took your vaccine and what type
I
of
think
vaccine?
it is in your best interest to do so. Yeah, because if you want to go international travel or you want to do something and they want to know if you've been vaccinated, I think it's important to have it and to keep it with you all the time,
Yeah, Dr. Callender,
especially if you're going to do international travel.
I just read yesterday that CDC is not requiring it, but like, as you suggested, having it is pretty good, for travel at least.
Yeah, I think you keep it with you at all times. It's like, especially if you always keep your passport with you, and so you should also keep your vaccine status with you.
What about, good morning. My son, I think I may have mentioned this before. He's 15. So when he got the last booster shot, well, each time he's had the booster shot, he had a bad reaction. But the last time he had the booster shot, he said, Mom, it felt like I could feel all the blood pulsing through my body, like each cell of his body. And he was like that for like 3 or 4 days. So like now and he was like lethargic, laying around in bed. So now I'm like really apprehensive about doing that. Is there have you read anything that we can do to help him not have such an adverse effect, or does it just happen with certain people for them in these booster shots? Because I was perfectly fine. My husband was perfectly fine. But my other son was bad, but he wasn't as bad as my youngest, like literally couldn't move.
Well, I don't know. Who is their doctor?
There he has a pediatrician,
He
Dr.
should talk.
Kelly.
He should talk with his pediatrician.
Okay, yeah.
Yeah, because that's special. That's not that's just different from most people. So
Okay.
I would have him talk to his pediatrician and get
Okay.
his advice, because that's different. If you have something like that gives you such symptoms, such side effects,
Yeah.
then there's a concern. There's a concern.
Speaking of side effects,
Yeah. Yeah, this is a great timely article that talks about the side effects that, and since many of us have not gotten it, it's just not, the side effects not dissimilar to the COVID vaccine we had in the past for most of us, because fatigue, headache, joint pain, and keep going down, see if there are any others that they have. Nausea was rare, pain at the sight, and some people had swollen lymph nodes. Those are the standard ones that most of us have had, with the first three being the most common. Pain at the injection site is interesting because it usually isn't associated early on, but may occur later on. And swollen lymph nodes occur in some people and others not. Fever is not often the case, but I've always recommended that people take Tylenol right after, before, and maybe if they get any side effects after that, whether it's fatigue or headache, any symptoms. The Tylenol is every 4 hours is a good idea.
Dr. Callender, is Tylenol okay for children?
Yeah.
Yes, sir.
Yeah.
Yeah, they have
Yes.
children home.
It's better than safer than aspirin. Yeah.
Yeah.
That might be good for her sons.
Yeah, children's Tylenol over the counter.
Yeah, that's what their pediatrician may recommend. May recommend taking some other medication with it if they take it at all. Right.
My question, Dr. Callender, will be if your child has experienced these kinds of symptoms before, is there a way that they could maybe take the newest vaccines in part A, and then come back later and take part B or anything like that?
No, we don't know anything about that. I would, just as I said, I would recommend that they talk it over with their pediatrician to decide whether or not they should take medications before they take the vaccine, or whether they should take the vaccine at all. But there's no part A, part B. Because in other words, it's one vaccine.
Dr.
Not like-
Callender, I'm taking all these vaccinations. Can any of them be injected in the stomach, or they all have to be in your arm muscle?
They can be anywhere you want it. Doesn't have to be your arm. It's just convenient. It can be in the stomach. In the
Okay,
butt.
because when I got my flu shot with my last physical, they told me I could only get that in my arms muscle and not in my stomach, because they never heard of that before.
Oh, I don't. Well, I'm not familiar with anything that requires it to be given that mandates that it be given in the shoulder. Although we do it because it's convenient. But I don't know anybody who has refused to get it in the shoulder. So to me, it's a subcutaneous injection. And like most subcutaneous injections, it can be given anywhere. That means it's under the skin. Okay, so, but I don't know what vaccination center you went to and what kind of regulation they have. But as far as I know, it's required to be given subcutaneously, not necessarily in the shoulder, but subcutaneously.
It was in a doctor's office with the nurse giving it, and she said she never heard of that before, giving it in the stomach. So I was just wondering.
Well, subcutaneous, that's what is required. It means under the skin. It's going to be under the skin anywhere.
So if I go to CVS and ask them to give it in my stomach, I just heard that you don't feel anything.
Well, I don't know about that. The reason that they will tell you that is because you've got to undress.
All you have to do is just lift up your shirt, right? And they put it in your stomach.
Well, that depends on where you're going to get it. So that may be why they have said that. But subcutaneous means under the skin, period. So it can be under the skin anywhere.
Say that to her, Carolyn. If she don't understand that, don't let her give you no injection.
Well, but I think that people have to do things that they're comfortable with. If they don't know any better, they can't do any better.
Right,
So,
that's what I'm saying. If she don't know, she shouldn't do it.
How do you spell that word sulfur, whatever it is?
subcutaneous, SUB hyphen CUTANEOUS, subcutaneous. Means under the skin. That's all it means. That's what subcutaneous means. That's what the vaccines are usually given. There's some medication are given intramuscularly. That's not one of them. This is given subcutaneously. So it could be given anywhere under the skin.
I don't know what that means. Don't look.
I'm sorry? Yeah, that's what subcutaneous means, under the skin. Yeah.
And Carol, if you can't remember that big word, just say under the skin.
Right. That's what it means. Subcutaneous means under the skin.
Has
Intramuscular
anybody
means,
ever gotten a shot in their stomach?
I have.
Okay.
And
You
they're
know,
behind.
The reason why I do mine in my stomach, because I can grab a roll of fat in my stomach. They can put the needle and I won't feel nothing.
well, I give my wife B12 injections, and I give them in the butt just because there's a lot of subcutaneous tissue there. And so I give it in the shoulder as well sometimes, but most often I give it in the butt because there's a lot of fatty tissue there, so it can be absorbed. And
Dr. Callender, John may bring up something that triggers something. If you have an individual with I'll just say a bloated belly, and they want to get the injection in their stomach, how much layer of fat does the medicine has to get down to? I mean, if it can't get past the fat, is it effective?
yes,
Okay.
that's why it's subcutaneous. So if they wanted it to be intramuscular, some things have to be given intramuscularly, but the vaccines are generally given under the skin. So if they're given under the skin, they can be absorbed effectively, and you don't have to worry about the fact that people have loads of fat.
Yeah. Okay. Thank you.
But if they say intramuscular, that's different because then you have to go through the fat to the muscle.
Okay, so what shots are you have to give in the arm, intramuscular, whatever?
Well, I don't know any shots. See, for example, all of the shots that I know, all the vaccines that I know of are subcutaneous. Even those that you have to take to go overseas. Most of those all of them that I know of are subcutaneous. Now, even though the reaction you may get is sometimes like the smallpox and those other ones are associated with much more pain than the others, they still are. They're not intramuscular. They're subcutaneous. But I think that's a very good question that you raised, though. Why? But I thought that the most common reason for doing it in the shoulders for convenience.
Easy access.
Yeah, right.
Well, just raising your blouse, that's easier than, or a shirt, that's easier than pulling your pants down.
That depends on whether you're a man or a woman and whether you have sensitivities relative to having a woman pull up her blouse. It all depends on your perspective. I don't.
I don't understand.
And
It's showing your
here,
stomach,
it
right?
depends. Okay, it depends upon your bias. If maybe that's a better way of saying it, because you see it that it's simpler than pulling up your shirt, and may well be, but it's just that most people do it the other way. I think it's a matter of they're used to doing it that way, so they do it.
Okay.
But I think it's a good idea to ask them, say, is it all right if I take it in my stomach instead of my shoulder? And if they say no, they can say, oh, I thought it was subcutaneous. But then they may say something else. But it just goes to show that we all have biases, that some people, they aren't really laws or rules, just things that we become accustomed to doing. So we think that is the only way to do it, but it isn't. This is an article that has come about because there are many people who, after they get Paxlovid, they get a rebound phenomenon. And they came into question as to whether the Paxlovid was really working. Most of the subsequent tests have identified that the rebound phenomenon, it does not mean that the Paxlovid is not working. And so as a consequence, this article and many others have looked at Paxlovid. Now, Paxlovid is a drug that is treating the virus instead of preventing the virus. It's killing the virus instead of the vaccines prevent the virus. Paxlovid kills the virus. And so there have been many studies. As you recall, I think the president and some others had a rebound after Paxlovid. And so there was a question, does this mean that it's not effective? And the fact that you tested positive days after recovering from the virus, that mean that it didn't do its job. And so as a consequence, and then of course there are many medications that are contraindicate the use of Paxlovid. And so these are all issues that have caused the use of Paxlovid to be reevaluated and considered. And that's why I've done these studies. And the studies seem to indicate that it does ward off disease and death, COVID. And whether you have the so-called rebound phenomenon or not, it is effective at doing it. So if you go down the article, it will point out that there is an increased incidence of appearance of rebound, but in spite of this, it's still effective at killing the COVID virus. There are only two medications, I believe, that are effective at actually killing the virus. Paxlovid is one of them, and I forget the name of the other. I don't know if they included that in this article, but this is for those who, in spite of the vaccine, get the COVID virus and get sick. This is one of the treatments that has been found to be effective. Any comments or questions? Any of you have that rebound phenomenon with Paxlovid?
Dr. Callender, I don't have a question on the rebound, but when you first get COVID, okay, you have the symptoms and you take your test and you say, oh, I have COVID. You contact your doctor. Let's say it's been over a week or so. How soon do you need to get the Paxlovid? I mean,
the sooner the better. But many people feel if you don't have a bad case of it. Now, if you're over 65, unless you have contraindications, the feeling is that you probably should take it. But if you have a mild, very mild case and all you have is a little fatigue and no fever and no hypoxia, some people feel that going without it is okay.
oh,
But
so we should.
if you're over 65, if you have anything that's other than extremely mild, the recommendation is that you take Paxlovid. That's the going reputation. But my feeling is if you have no symptoms at all, or you have extremely mild symptoms, I think I wouldn't bother taking it. But
well, I remember when I had it, the first symptom was a sore throat, and then coughing. And so I was and my mom had it, and she had a sore throat and coughing for quite some time. And she, right now she's 92. And I was just wondering, when I told her call her doctor and let her doctor know that she had it, but she didn't recommend anything. Just say you should have called me sooner. She's like, huh?
Well, the sooner you get it, the better. But if it's very extremely mild, when you're over 80, then of course the risk of progression is greater. And if you're 92, then the concern is even greater. But then you have to look at the medications that you're taking, whether you have any kidney disease or anything like that, because those are contraindications to the use of the drug.
Okay.
Dr. Callender, I heard that because I've had COVID twice, right? And the second time I got it, somebody mentioned, well, they had tried Paxlovid And I went to the doctor. I called the doctor, and the doctor said, "Well, when did your symptoms appear?" And it was like the fourth day, and they said no. So they recommended that you started within 3 days of symptoms.
Sounds okay. It's all right. I think the fewer symptoms you have, the less the need for it.
And this is Vivian. I had a transplant, and when I went to urgent care, they told me I had COVID. They gave me a prescription for Paxlovid. I called the transplant center. They told me I could not take that. I had to come in, and they gave me the other medication. So,
Right. Okay. And one of the reasons is that the Paxlovid cannot be used with a number of medications. And there's a long list of medications that you can't take Paxlovid with, or you have to stop some of the medications until after you finish the Paxlovid. So I think that makes sense then, to understand if you're a transplant patient, you're on a number of medications. And so you have to reconcile that with that. Any other comments or questions about that? Not.
I have one comment. The scary part about what my mom just said is she told the doctor at the urgent care that she was a transplant patient, and they still said that she can take it. But we remember the rule that they said with her transplant that always call the kidney place, the transplant people, let them know what they're doing. But the doctors was adamant at the urgent care that she can just take the medicine without doing anything. That's all.
Well, I think that's good advice. Your transplant team should know and be advised about what's going on, because they know what medications you're on. So that's a inviolate rule that you should always follow. Let your transplant team know exactly what's going on. Now, this article talks about an incurable kidney disease. And the question is, what do you mean by an incurable kidney disease? And usually what that means is that your creatinine and BUN and glomerular filtration rates at the point where dialysis or transplantation are the next treatments. And there's a condition called nephrotic syndrome, where you get swelling of all over the body. And actually, that is there is a treatment for it, because it's actually it's like immunosuppressive drugs that they use, steroids and other drugs, and so they're able to treat that. And a kidney biopsy gets an idea of whether you have a kidney condition that can be treated. And so to say that it's incurable, it actually is usually only said after a kidney biopsy, or looking at the blood results to see what your BUN is, what your creatinine is, and what your glomerular filtration rate is. And since they don't tell you any of this, it's hard to say. Although what she talks about sounds like nephrotic syndrome. And it's a disease that is treated. And in about 30 to 40% of the cases, it is reversible. But they don't tell you enough information just to let you know exactly what kind of kidney disease she had, or what the biopsy showed. But most of the kidney diseases that give you the kind of side effects that she had are treated with immunosuppressive drugs and steroids. And often, about 30 to 40% of the cases are reversible.
Dr. Callender, last session, we talked about Jardiance as being one of those medicines that can slow down the progression of kidney disease.
That's correct. But then you have to know what state of kidney disease are you in? Do you have a GFR of 80, 60, 40, 20, or less? So you need to know that, because then if you have a GFR of less than 20, then the likelihood of reversal is close to zero. If you have a glomerular filtration rate of above 40, then it's likely to be reversible. So, but none of that information is in this article, so it's hard to tell. Except that most people have the swelling that she has, usually have a nephrotic syndrome, which is able to be treated by immunosuppressive medications.
Dr. Callender, that was my question the whole time reading this. They did not say, and they implied that they knew what it was, but she wanted it to be private. You know?
Right. That's right. Yeah. But to call it incurable, that's why that's a term that requires specific information, like knowing what the biopsy showed. Right.
So
Dr. Callender,
I didn't see it. Did she have a biopsy?
Yes.
Oh, okay. I missed that.
Dr. Callender, do you think that maybe because she didn't want to use steroids, that's why they were calling it incurable? Because I know they test for steroids in sports and stuff. And maybe because she can't use steroids, she felt like it couldn't be reversed.
Well, I think the most important issue is getting well, not
Right, I think so too.
not competing.
I understand, but that's just like some men won't take their high blood pressure medicine, didn't take their high blood medicine because it messed with their nature. So I mean, sense doesn't always make sense.
Okay. Well, I have no idea why she would say that, but I think that steroids, you're right, is contraindicated if you're going to be an Olympic competition. So it does make sense that she might, that may have been part of her thinking, her thought process. Because all of the treatments involve steroids.
Right.
Yeah. This is an article that, as you know, there are many medications for that prevent your blood from clotting. Just about all of them are associated with an increased risk of bleeding. And so they now developed a factor 11 inhibitor, which suggests that this is the only drug that may be safe from the risk of bleeding. And anybody who has atrial fibrillation is on the medications that prevent clotting. And all of these are associated with an increased risk of bleeding. And they talk about why factor 11 works and is not associated with bleeding. Because all of these medications are done to prevent clotting, because the clots are dangerous, they block supply. And the one that's most dangerous is warfarin. The one that's the least dangerous is It's interesting. They don't mention the other ones, but warfarin is the oldest one. So now this has just become available. How soon it will be actually on the market is another question. But just to let you know that there is a drug that for which is maybe safer than the other ones.
Oh, good to know.
When it's interesting when all of those anticoagulants come out, they all are considered safe until somebody gets bleeding complications. So let's see if this is going to be different.
Mm.
You may have all have heard of feces, fecal transplants, which have been used to eliminate C. difficile and other causes of colitis.
Mm.
And so now we have waste from animals that kills the bacterial species that may be resistant to antibiotics and
Wow.
cause foot ulcers that result in amputations. And so these researchers found that the feces of some of these animals was able to knock off these bacterial species that were resistant to traditional antibiotics. And so that although they stink, it appears that this may be one of the treatments that you can use when the antibiotics does not work for the infection that is causing the diabetic to lose his foot. So, so this is something new, and whether this will turn out to be the panacea for drug-resistant antibiotics remains to be seen. But this is to let you know that is now, this is one of the new treatments that is being done. In the old days, before you had a diabetic foot, they'd give you some maggots to put on your wound to heal it. And so this is now using feces for that. John Buchanan, you had a question.
I was just wondering how the heck would anybody even think of doing that? Taking poo from an animal and getting the viruses out of that. I mean,
you'd be amazed at the type of research that goes on.
It seems a little crazy, but it worked though, didn't it?
Well, you got to remember, fecal transplants. We've been doing fecal transplants for a while now. And they take the feces from patients and they put it into a pill and they give it to them. So we've been doing fecal transplants for a while. So this is just another spinoff of that.
But that in that case, that's your own. That's your own feces.
No, it's not your own feces. It's somebody else's. It's somebody else's. See, because your colon does not have those bacteria in it. So you get it from another person and who has those good bacteria. And they put it in a pill and they give it to you and you take it and so it's not your feces, it's somebody else's.
But I'm just wondering, with these endangered species, how the heck would anybody think to to experiment and find those viruses? That it just seems far out. But I guess.
Well, you'd be amazed at the kind of research that goes on. So
feces treatment has been around for a while. It's called phage therapies, first discovered early 20th century. That means 1900s. And where they use poo from various animals, including guinea baboons, lemurs, pigs, for treatment. So that's been a while. That's been kicking around for quite a while.
Well, this has not been around for quite a while. The fecal transplants actually are a little different in the sense that they use humans for that, for the fecal transplants that is used differently. Remember, this is what they put on a wound, which is different from the fecal transplant where they give you a pill to have good bacteria in your colon, and that has actually been used probably for the last 10 or 15 years, where they give it to you to take as a pill. Now this is a little different, and you're just putting this on the wound itself to help fight off the bacteria which are not sensitive to antibiotics.
Dr. Callender, I don't know if you reminded them though, before they put this in pill form, the way they used to do transplant.
Yeah, I wasn't gonna bring that up, but yeah, but now they sophisticated it so that they put it in a pill. Yeah.
They used to do it in China. That's where it started with the eating.
This
Good morning.
aspect. Go ahead.
This is Elizabeth. I was looking at some research that they did, some years ago, where in some mental institution where they use the good bacteria from another human that did not have the mental illness, and they utilized it to help the person use the good bacteria to help the person with the bad bacteria to help them get better. So yeah, I totally agree. This has been around a while in some form or another.
Oh, in some form or another, yeah. But it really hasn't been effectively used up until the last 10 or 15 years because they had to define what it is. Because, the atrocities that have occurred in the past with people experimenting with people in mental institutions and others have not been reputable. And so a lot of that is just not repeated. But the use of these particular fecal transplants that are used as medications for colitis, for the treatment of Clostridial difficile colitis, has been actually just over the last 10 years where it's been effectively used to the point now that you have pills that have feces in them that are administered to patients as treatment for intractable diarrhea is what they will call it, which is different from the treatment that you and Darryl are talking about that has been used for a lot of different things. But and this now is one that is suggested to be used for a new variety of ailments, which is drug-resistant antibiotics. In other words, the conventional antibiotics that we use is not effective on these bacteria. And so for that reason, you develop this bacteriophage therapy, which has the feces from what Darryl talked about, and giving this on a wound, which is a new way of treating diabetic foot infections, which reminded me of the old days when they were using maggots to clean out infection. That's 50, 60 years ago.
The other thing to remember, Dr. Callender, is that this now has reached the category of being called a transplant.
Well, this is now the fecal transplant
Yes.
is now well known, but they have they you notice they didn't use that term here. They talked about bacteriophage and that, but they didn't use that term fecal transplant. But that's what it is actually. What it is. Yeah. It's interesting. I didn't realize that millions of people have had to be treated for rabies. In other words, they were exposed to bats or other animals that carry rabies. They then get a preventive monoclonal antibody that well, actually, they got treatment that was preventive of the rabies because rabies is fatal, and that requires multiple injections. And so, the fact that they now have a single dose monoclonal antibody therapy uh, would be less painful, and more people would be likely to be willing to take the treatment. And so, this is a anti-rabies treatment. I don't know how many of you have ever had a bat in your house, but if you have a bat in your house, then they will traditionally treat you for rabies to prevent the rabies from occurring because rabies is fatal. And so this one single dose therapy would be a marvelous finding. And this is something that has just been developed.
Buchanan.
Yeah, Dr. Callender, remind me of in the past when somebody got rabies, they had to go back, for all these shots. How many shots did they have to get? And they were very painful. So maybe they were intramuscular shots for against rabies.
I'm not sure how many shots they took. I know it was, I had one of my friends who, one of my colleagues who a bat came into the house and just and the bat escaped. Now, if the bat is found and you can test it and find that it doesn't have rabies, that's fine. But if the bat escapes and you can't test, then they give you this treatment for rabies, which has a number of injections that occur. I do not know how many, and I don't know whether they're intramuscular or not, but I do know that there's a series of treatments that some people have described as complex. I don't know whether it's painful or not, but I do know that if this comes to play and there's only one single dose, that would make it even easier for most of the people because you can see here that the others have multiple treatment injections, and I think that they are intramuscular, but I don't recall. I don't know. But apparently, none of you have had a bat in your house, huh?
Nope.
Well, this is good.
Dr. Callender, I read an article that says if you want to know if bats are in your neighborhood, just go and stand afar at dusk and look up at the chimney. And if you see some little insects flying out, then that's a good indication.
Oh. Well, most people aren't able to do that. So what they do know, they keep the windows down, and if a bat somehow gets into the house, then unless you're able to find the bat and have the bat tested to be sure that the bat does not have the rabies. But
this article was only talking about houses that have chimneys.
I see. Okay.
Yeah. Internet says that 4 rabies shots is a standard, or 5 if a person's immune system is suppressed.
Does it say whether it's intramuscular or or does it just say injections?
Let me check.
Isn't that interesting? 90% of all rabies deaths occur in Africa and Asia.
Yeah. Rabies vaccines are intramuscular.
Oh, yeah. Well, that means it's pain. Yeah, it's pain.
I kind of guessed that because historically they're very, very painful. And the number that popped in my head was 5. I didn't want to
Mm-hmm.
say that, but yeah, 5 very pain, and you had to come back like every day or every couple of days to get it.
Yeah.
Dr. Callender, I'm confused. Are we saying the individuals got bitten by the bat? Because you
No,
mentioned just
no,
if the
all they
bat
have
is
to
in
do
the
is
house.
get in the house. That's all. If they're in the house, the presumption is that they'll spread it. So my colleague had to get those rabies injections.
When Carol and I were growing up, a bat got in the house and my mother chased him out the back door with a broom.
Mhm.
And to get the bat out of the house, it took 4 doses of broom.
Did you guys take rabies shots?
Hell no.
No.
Mm. Yeah, well, nowadays, if you find a bat in the house and they're not able to test it, they will presumptively give you anti-rabies treatments.
Dr. Callender, didn't we have an article about dogs biting people in a country where there were like 2 deaths per week? Do anyone
No,
remember that?
no.
We had I think it was Hades.
Oh, yeah, another country. I'll see.
Yeah. All right.
No, I'm not familiar with that one.
Yeah, I'm trying to remember the article that we had on that one. But anyway,
Any other comments about the rabies? If not, it's something to keep in mind that if a bat does occur in the house, that usually they come in, people who don't have chimneys, they come in through the window, open window or a screen that's not got a hole in it or something. Yeah. This is an interesting article that opens up an arena for discussion. This lady's suing for malpractice because she had gender affirming care and double mastectomy as a teen, claiming she was too young to consent. And you remember the furor that has been going on about doing gender affirming surgeries on people who are not of majority age. And so this is opening Pandora's box here. And so she's suing, saying that they did before she was young to understand fully what was going on. And this is the transgender issue is one that is coming to fore nowadays. And it's interesting since Obama has actually opened the door for much of this. Gender affirming surgery on people who are not of age has become an issue of lengthy discussions. Any of you had to deal with any of this?
I didn't think they did surgery on people younger than 21.
They
I
do.
thought they only used drugs or reversible. Anything they did as a young person, it was reversible.
Well, things have changed now because
Oh,
yeah, they're doing them on people who are under 18.
yeah.
And yeah, and that then becomes an issue for this lady. Of course, this is one of the first cases I've seen like this, but when
Yeah,
the parents consent to it, even if the child gives assent to it, which they can do, they're still underage. So it's just a matter of time before this kind of case would come up.
Dr. Callender, I why wouldn't she sue the parents rather than the hospital? The hospital's doing what the parents.
Hospital's got more money.
Right. But the hospital is following the instruction of the parent.
Common sense, isn't it?
Dr.
But-
Callender, was this as a teenager, or was this when the child was born and they couldn't tell if it was male or female?
She's a teenager. She was a teenager.
Because I had a friend many years ago had a child that they couldn't tell if it was male or female,
Hermaphrodite, huh?
and they did a surgery on them.
Yeah, that's different because that child could not consent, whereas a teenager is different.
Yeah.
Yeah, the hermaphrodite condition where they're born with both sexes.
Right.
They would have, yeah, and so they would have to make a decision as to which kind of surgery they would do, and then only the parents could make a decision. Whereas with the teenager, they could get the assent of the teenager. So it sounded like the teenager agreed with it, but then as they got older, they disagreed with it.
I don't think they should do surgery on somebody under 21.
Just like you said, most of the treatments are hormonal.
Yeah, that's what I think, because those are reversible, aren't they, Dr.
Yeah.
Callender?
Yes. Yeah.
If you're under 21, I would say if you're younger than 30, you you don't start thinking right until you get into your 30s.
Well, the law says 18 or 21. So
I know, but the law, I understand that, but I think that under 21 is too much, and they can wait. They wait for everything else.
any other points? Interesting point. Makes sense. What you say makes sense.
And it says for men that the brain finishes developing in maturity in mid to late 20s.
Yeah.
So, yeah, for men, they shouldn't be able to make any decisions about sexual identity until they're 70.
Thank you, Darryl.
Yeah, that was about 5 years ago for me.
And this, I think, this may be the last article. Oh wow! So 10:30 already. This is something new that a parasite that they weren't familiar with. That it's found in rat lungworms. Rats are undesirable for many reasons, but now we have another reason for them to be undesirable. And this rat worm lives in the rat's lungs and can come out of the lungs and get into the feces, and then that can get into the food and then get into the brain and be lethal. So it's just a new, just like we don't have enough bacteria and parasites and viruses, now we got a new one to worry about. Hasn't come into this country yet, but anyway, it's something to know about.
Yes, and this is one of the ones that, Black people don't have to worry about by themselves.
This is an article that talks about standardizing blood pressure training for medicine for doctors, PAs, and nursing schools. Actually, as far as I'm concerned, it should be for everyone because hypertension is so common, and I'm for training all patients. All patients should have blood pressure apparatuses at home, and they should take their own blood pressures and record them. Obviously, it should be present in schools, but to me, it should be at home as well.
Yeah, I agree.
And then the standard should be the same, as they have a standard here. But as I look at the way it's done in hospitals, they often are not willing to wait for arresting the patient and taking time out. And that's why the blood pressure at home is the more accurate.
Mhm.
Do all of you have blood pressure apparatuses at home?
I do.
Okay.
Yeah, I think all,
I do.
especially all people of color should, because hypertension is so common. Yeah.
So getting back to that question about being on the blood pressure medication, if you're on medication, but yet your blood pressure is still high, you got to tell your doctor, right? Is that the deal?
Yeah.
Absolutely, because you're not controlled. And if you're not controlled, then all of the side effects of hypertension can occur: stroke, heart attack, kidney disease, you name it. So just because you're on blood pressure medicine, if it's not controlled, then it must be controlled. Otherwise, you're at risk. And that's why I feel every home should have it. And that if you're over 130, then it's a concern.
Dr. Callender, when I went to Myrtle Beach, I went to a church, and at that church, they had a health day, and they gave every person over 50 a blood pressure monitor. And then they had people that came in and showed everybody and worked with everybody individually to show them how to use. And I thought that was a wonderful thing.
I agree. I agree with
But
you.
I had never heard of anybody doing anything like that, but I thought it was a great idea. And because we were visitors and we were over 50, they gave us blood pressure cuffs too.
That's wonderful. That's the way it should be.